My name is Mary Wright. I'm a pediatric nurse practitioner at Kaiser Santa Clara. I work in the Department of Pediatric Endocrinology. The most rewarding part about this job is just that you have such an incredible opportunity to make a difference for people when they're probably sometimes at the worst part. One of the worst things that's happened to them is a child getting sick and having a chronic illness. To be in a position where you can really make a difference during that time and hopefully make it better for them means a lot to me. Drawing from personal experience and taking that experience and using it to hopefully help other people is very meaningful. I think initially when they're first diagnosed, I think just seeing someone who can have a career and be married and have kids, healthy kids, and I think that shows them something right off that maybe they wouldn't know from reading in a book. I mean, I think it helps them to see someone who's living a normal life.
Has he had any fevers, any stomach problems?
I do a lot of phone and email advice for families with kids with diabetes. There's a lot on these families. And actually for school nurses also, that, everyone's it takes a village to manage diabetes. We try to be available to families and to nurses in the schools so that people can call and say, hey, my child's really sick, their blood sugar's all over the place, I don't know what to do, and we'll help them through that. And then there's a big education component too, where we'll try and empower families to learn how to adjust their own insulin and how to care for this at home. I've seen a same diagnosis hit families very differently, and I think through that I've seen that, bad things are going to happen. Sometimes challenges are going to happen in our life, and I've really learned that you may not have control over what challenges you get, but you certainly have control over how you respond to them. And I think that many of my families have been so inspiring. They take a challenge and they just go, this is our challenge, and they rise to it, and they do well and they live life. I know that I live with type 1 diabetes, but I also think that having a child with type 1 diabetes is still a little bit different. So I think I've learned from my patients what kind of challenges you can overcome.
And if you don't, you can always call us and we can help.
The diabetes community has given me so much. I mean, I love my job, and I don't think I would have been in here if I hadn't been part of this whole community. I would have never probably become a nurse if I hadn't been part of that community, so I'm very thankful for what they've done for me.